1,300 public health officials admitted in a signed letter that the Black Lives Matter protests, crowds of people packed together, was not a COVID-19 threat. But the anti-lockdown protests was a COVID-19 threat. Here's the thing. We should have seen this hypocrisy coming. Because in the whole course of the COVID-19 outbreak, as pundits and politicians implored us to listen to the experts, listen to the epidemiologists, what have epidemiologists been right about? Have they been right about anything? I don't think so. They told us COVID-19 would kill 2 million Americans. Didn't happen. They told us the infection fatality rate of COVID-19 was 3.4%. It isn't. It isn't even close. They told us COVID-19 doesn't discriminate based on age. It actually does. They're still telling us it's dangerous to send kids back to school. It's not. Kids are more likely to die from the flu than from COVID-19, and they aren't significant carriers of the virus either. They told us asymptomatic carriers were unwittingly killing Granny, but they weren't. The World Health Organization said asymptomatic cases are rarely transmissible. They told us hospitals would be overwhelmed and overflow, and we'd have to ration care. It never happened. It was never even close. They told us we need tens of thousands of ventilators. We didn't. They told us up to 80% of the population would need to be infected before we reach herd immunity. The real number is closer to 30 or 60%. They told us lockdowns were the only way to stop the spread of the virus. Not true. 60% of new hospitalizations in New York, according to data from Governor Cuomo last month, were people who were locked down and transmitted the virus intrafamilial. They told us the seed date of the virus was in February. It wasn't. In France, it was as early as December. They told us the reproduction rate of the virus was slowed by lockdowns. It wasn't. The reproduction rate was slowed by individual social distancing. And studies show the lockdowns themselves had little to no impact on the epidemic curve of the virus. They told us going to the beach was dangerous. It's not. Outdoor transmission is 18 times less likely than indoor transmission. They told us nursing homes must admit residents who tested positive for COVID-19, implying it wasn't a threat. It is. Almost half of all COVID deaths in the U.S. are in nursing homes. And now they're telling us that the recent spike in positive tests in Florida, in Texas, in Georgia are signs of a second wave of the virus. It's not. It's because of increased testing. Why should we listen to these people now when they've destroyed our economy, admitted their political hypocrisy, and been wrong about the science every single time?